Hello, all the busy moms. I hope you had a great week and so far, and everything is going good at your end. Um, I had a great response with my podcast, and those of you who spent time to listen to the whole podcast episode, I'm really thankful to you. Thank you so much for making that time and giving me your feedback. But some of my patients have told me how much they loved it and how informative it is, and how they have shared it with some of their female friends and coworkers and family members to bring awareness. So if you haven't checked it out, you can visit my business page, Active Body, Active Life, or go to my personal page, and I have linked to my podcast episode, and do listen to it. It's half hour, but it's so much more information on just different topics, pelvic pain, and how things change after pregnancy, and just different pelvic floor problems that women go through throughout different phases of life. So I'm really glad that a lot of people have found the podcast very helpful. I'll be recording another one tomorrow, and hopefully it will be available for everybody to listen in a few days after that. So I'll be posting for that too. Make sure you look out for the link and give it a watch. Or listen to it and give me a feedback. I love feedback. If you think I should be talking about something that you're interested in, I can make another episode on that. So let me know what topics you're interested in, or any health concern you have and you would like me to talk on that topic. I can either do Facebook Live, or I can do a podcast episode based on how much detail I need to discuss about that topic. So my today's talk is going to be about what are the risk factors that predisposes you to pelvic floor problems or different gynecological and pelvic problems, because not everything has to be an injury. Sometimes there are just factors that you can avoid to reduce the risk of you having a pelvic floor problem going forward if you don't already have it. And if you have the problem that you know you have something going on but you haven't addressed it, you haven't treated it, can you control these factors to stop the problem from getting any worse? And pelvic floor problems could be organ prolapse, urine leakage, chronic constipation, or stool leakage. It could be pain with sex or intercourse, or it can be painful gynecological examination. All of these are just signs and symptoms of different pelvic floor problems, and most of them have some influence from, or a lot of influence from, pelvic floor muscles that affect your symptom. So if you want to prevent these problems, the risk factors are childbirth. So becoming pregnant, going through pregnancy and childbirth is basically number one risk factor for predisposing yourself to pelvic floor problems. Now, of course, you can't always avoid it. I do recommend some of my patients who come in for low back pain and they're planning to get pregnant, I tell them to get the pelvic floor checked before you plan to become pregnant, unless it's an unexpected pregnancy, and let one of the pelvic floor therapists nearby your house to check the pelvic floor and the abdominals and the lower back, the whole complex, to make sure it's functioning the way it should function. So when you become pregnant and when your pregnancy progresses, especially the last trimester when there are so many changes going on and the baby is getting heavier, your muscles and all the coordination and the nervous system is doing its job to the fullest, and you can have so much healthier pregnancy. So childbirth, pregnancy, delivery, now you can have episiotomy or C-section. That only adds to the trauma and can really change how your muscles function, and it can also change your nervous system from the pain itself or from the incision itself. There are other risk factors that could be drinking too much caffeine or alcohol. That can irritate the bladder, and that can still lead to some pelvic floor problems. Miscarriage or DNC or any pelvic or abdominal surgery, even if it's laparoscopy, they're not making a big incision, that can still disrupt the nervous system. It can because they're going through different layers even when they're not making a big incision, and that can still lead to some pelvic floor dysfunction. Sometimes people would say, oh, I had my DNC, or I had a miscarriage, or I had some abdominal surgery, laparoscopic, to explore if I have any cyst, wherever, and then they start leaking urine after that, and they don't know what went wrong. Nothing else happened. A lot of time these procedures, it could be appendix removed, it could be even just the scar tissue from the procedure that can change the nervous system and your muscle coordination and strength, and that can over the period of time lead to some pelvic floor dysfunction and incoordination and weakness or tightness. So another factor could be multiple or even single urinary tract infection can lead to some changes in pelvic floor function. But if somebody has multiple urinary tract infections, that is a concern. It could be that you have pelvic floor dysfunction that's leading to multiple urinary tract infections or similar symptoms, and you can't be on antibiotics forever. Or it could be UTIs leading to pelvic floor dysfunction. So it can go both ways. Sexual trauma can lead to a lot of pelvic floor dysfunction. Now, we can't always prevent that, but that just, if somebody has gone through sexual trauma, it can make that person more likely to have pelvic floor problems. So if you're experiencing any symptoms that I have been talking about, urine leakage, pain with sex, chronic back pain that doesn't get better, there could be some interrelationship, and we can address that as we get to the root cause of the problem. Irritable bowel syndrome, interstitial cystitis, some of the autoimmune conditions, chronic lung diseases, because then the person is coughing a lot. Smokers, if they have really bad smoking habits and they have a chronic cough, that can lead to pelvic floor problems as well. Abdominal muscle separation can lead to pelvic floor problem if not addressed properly. People who work out, or weightlifters and heavy intensity workouts, if they are not using proper techniques, they are more prone to having pelvic floor dysfunction as well. So these are just some of the risk factors. Obesity is a risk factor. Just the fact that you have additional weight on your body can lead to some pelvic floor problems as well. So obesity, caffeine consumption, smoking, alcohol use, so these are some of, or avoiding chronic constipation, eating enough fibers and healthy diet, and drinking lots of water to prevent UTIs as well as constipation. You can do these things, you can make these minor changes in your life to prevent long-term pelvic floor problems. So I hope you find this helpful, and let me know if you have any question or anything related to what I was talking about right now, or if it's a completely non-related topic, I can still address it and maybe do a video on that, or respond to you privately. Feel free to reach out to me, text me, call me at 214-210-0715, and let me know how I can help you. All right, bye, take care.